A couple of the subscribers to my YouTube channel have reached out and asked me what obsessive love disorder is. And they've left comments about it, asking me what I think, if they have it or not. Although I can't diagnose you on my YouTube channel, I do read your comments and I don't always respond, but believe me, I am taking notes and I am trying my best effort to always keep you feeling good in your relationship so you can create a relationship you love being part of and continue to maintain it. Obsessive love disorder is one of those things that I don't see very often. The acronym for it is OLD, so it's obsessive love disorder, and that's where it comes from. There's such a small population of people that have this, but when one of these people has it and is uncontrolled with medication or therapy, we usually read about it in magazines, we hear about it on TV, we watch it on late night TV shows because it's so catastrophic, not only to the person who has it, but anyone who they become obsessed with or delusionally believe that this person is in love with them. So what are the symptoms of it? Well, there's an overwhelming attraction to one person. There's obsessive thoughts about this person, feeling the need to protect this person that you personally are in love with, possessive thoughts and actions, and extreme jealousy over the other, that any interpersonal relationships that other person has. Now, I think what's interesting is that you don't necessarily, like, this other person isn't really in love with you. Like, they may not even hardly know you. They usually have heard of you, or usually they have seen you, but they don't know you at all. So how do you know? Like, what are some of the actions of this if you have this disorder? Well, you'll repeatedly text, emails, phone calls to the person that you're interested in. A constant need for reassurance. So basically, you constantly need feedback from this other person so that you know they're still in the loop. And believe me, if you're just friends with this person, or not even friends, this person is an acquaintance, they're going to know right away, okay, this is really odd. Like, I don't know why this person is acting like this. Difficulty having friendships or maintaining contact with family members because of the obsession that you have over this person. So people with OLD will actually, miss family dinners, miss family activities, stay at home so they can keep an eye on this person that they're obsessed with, monitoring the actions of the other person. So you find ways to kind of follow them either on social media, in your car, or whatever. And yes, some of these people will go to the extreme of stalking and controlling where the other person goes and the activities they engage in. So that if you are an acquaintance of this person, you may even start a rumor or gossip about why they shouldn't go there and give them warnings, which they will not take well. And this is why usually these people are left alone, because basically their attachment is delusional, it's not real, and the person who on the receiving end is extremely annoyed, if not a little frightened, like, who is this person and why are they going to this extent to do these behaviors toward me? So who are these people? What else do they have going on? What causes it? We really don't know what causes it. But different personality profiles, different things we do see correlated with it. One of those is borderline personality disorder, delusional jealousy. So if you have this sense that you are so jealous of anybody touching this person, and you tell yourself that this person feels the same way about you, so you have to protect them. Many times people that struggle with obsessive love disorder also have OCD, obsessive compulsive disorder, because you can see how the compulsion is very common in both of them to do the action. With OCD, you're going through rituals or actions or double checking. With old obsessive love disorder, you're obsessed with expressing the love, even though it's a distorted form. Obsessional jealousy. That means basically you're so obsessed with them that you get jealous if anyone else even looks their way or they interact at all. It really bothers you. You may watch the person, if they're talking to a neighbor, you may start feeling very jealous about it. So how is it diagnosed? Because it is so rare, we really need you to have a psych eval, a psychiatry eval, because basically what they do is they rule out other disorders. And then if they do believe that this is what you have, and usually these people have a history, and whoever, if it's an ex, or if it's a friend of yours, or maybe you personally have it, it will take a friend of you to get to the psychiatrist, because many times you'll make excuses because they don't understand that this person that you're obsessed with actually loves you too, which is all part of the delusion. The psychiatrist will usually talk to the other people closest to you, and then they'll suggest medications. The medications that work are the same ones that work with depression and anxiety, and they do have some new ones now. They'll also want you to go see a therapist. Cognitive behavioral therapy is probably the gold standard here. Can you get over it? You can work through it, but you're always going to probably err on this side. So I think what's important is once you are managed on medications and therapy, it is possible to move forward and actually have a healthy relationship, so long as you can be in touch that you do have a propensity toward this type of thing, and that the two of you would have boundaries, very strong boundaries, where you would check in with each other, where you would have them around you, and feedback between the two of you would have to remain transparent, honest, and you would have to be okay with basically trusting your partner to be kind of the person that you are accountable to in regards to how far are you going, are you getting a tinge of this back? Because like all kinds of disorders, when you introduce medication and you're on any psychotropic drugs, you do have to go in for checks, and you do have to make sure that they are at the same level and still working, because as you grow, as you change, as your hormones fluctuate, many times the medications you started out with are going to need to be reassigned, readdressed, and maybe even some new ones added or old ones taken away because they're no longer working for you to control this. Old obsessive love disorder is a very small population number. I mean, I may have seen one in my total career, but it's not the norm. Although I do think sometimes when people have OCD, they can flip into looking like this, but they don't actually have it.